Hello, my name is Stephanie, and today I will be performing the hand washing and sterile gloving skills video. I'll start off by washing my hands. Making sure that the water faucet isn't turned up so high to avoid any droppings falling around the sink area. I will place my hands under the water, keeping the elbows at an elevated position and the hands at a lower position here in the sink. Next, I will grab 3 to 5 milliliters of soap. I will lather for 15 seconds, making sure to get in between the fingers and under the nails to remove any debris or dirt. Now I will rinse my hands under the water. Again, keeping my elbows at an elevated position and my hands at a lower position. I will then grab a clean paper towel and pat dry my hands. I will start off at the fingertips and make my way up. We want to make sure that our hands are nice and dry. Get in between the fingers. I will grab another paper towel. Throw that away. I will grab a clean paper towel to turn the faucet off, making sure that I do not touch the faucet with my own fingers. And I will throw that away in the proper receptacle. The next step is to grab a sterile glove package from the supply room. I've already gone ahead and did that. I made sure that the gloves are my right size and that the package has never been opened. So what I want to do now is I want to unwrap the package. I can throw this away. I will grab the wrapper and I will place it on a flat, dry, clean surface. I will start unwrapping this. So this area out here is non-sterile, that's why I'm touching it, and so are these flaps here that I'm going to use to open up the wrapper. Again, we don't want to touch the inside area. We can go ahead, or it's safe to touch the outer areas as long as it's 1 inch outside of the wrapper here. These areas are non-sterile. So now what I want to do is I want to take my non-dominant hand and grab my dominant glove here. I will insert my hand into the proper spaces without rolling up the cuff. So I will do that as so, making sure to grab the glove like this. Insert my dominant hand. I've inserted my dominant hand into the proper spaces without moving the cuff or rolling it up to my wrist. The next thing that I want to do is I want to grab my dominant hand with the glove, insert it, insert 4 fingers into the folded cuff here and pick up the glove. I can grab this here just to hold on to the wrapper for easier access since it's not, this area is non-sterile. I picked up my non-dominant glove. Now I want to insert my dominant hand here slowly. Making sure that the cuff doesn't fold up. So now that I have done so, this is what it will look like. We are ready to perform our procedure. After the procedure is done, to remove the gloves properly, we can grab or pinch the glove here or here, pull it down so it turns inside out like this. And now we'll grab our two fingers, place them in here into the non-sterile area in the wrist, and turn that one inside out, I'm sorry, like this. Place it down here. We can go ahead and close this wrapper, throw it into the proper receptacle. Next, we'll perform hand hygiene. And we can exit the room.